Welcome to our CFCBT coronavirus video series. I'm Dr. Joti Brar-Josan, and our topic today is perinatal mood and anxiety disorders. My colleague, Dr. Nicky Singh, is joining us today. And to be honest, Nicky, you're the first person that comes to mind when I think about this topic. Not only did you focus on perinatal mental health for your dissertation, but you're also expecting your second child.
I am, yeah.
So thank you for taking the time to talk to us about this.
Definitely. Thanks for having me. Yeah, I think it's a really important area to discuss and bring awareness to.
Yeah, and it's nice for our listeners who are also expecting to feel like they're not alone in this and just get some useful information about this. But before we discuss the implications of COVID-19 on expecting parents, I wanted to just kind of check in with you and see how this last month has been for you and your family.
Yeah, well, it's, I think like a lot of pregnant women right now and just the population in general, it's a very uncertain time for everyone. So, we're just taking it day by day. New things are coming up. New information about COVID-19 is coming up. It looks like some of the restrictions are going to be lifted. So I feel like we're starting to see a light at the end of the tunnel. We just don't know when the tunnel will end.
So you're probably practicing just sitting with the uncertainty, but at the same time, hoping for some at the same time?
Absolutely. Yeah, just sitting with the uncertainty, kind of getting comfortable with it and knowing that this time is temporary. It's not going to last forever, but we just have to make the best of it right now.
Yeah, and if you think about parenting in general, I think that's a good philosophy to have, right? Like this is temporary, it lasts forever. So I'm glad to hear that you are, hanging in there and good. So I guess the first place to start that would make most sense for me is to just maybe, can you describe for our listeners what perinatal mood and anxiety disorders are?
Absolutely. So essentially any anxiety or depressive symptoms that are developed during either pregnancy or within the postpartum year, the first postpartum year. A lot of new moms experience what's commonly known as the blues after childbirth. So typically this looks like mood swings, a lot of tearfulness, of course, some anxiety, as well as difficulty sleeping. It's very common to see. We see about 80% of women struggling with the blues, and typically it lasts about 2 weeks. But for some women, maybe around 10% of women, these blues often persist. And so what we're seeing is more severe symptoms, longer lasting depressive symptoms. So we see feelings of guilt, we see tearfulness, difficulties bonding with the baby, lack of interest in activities a woman formerly enjoyed, irritability, and even for some, thoughts of harming themselves or baby. And in terms of anxiety, of course, there's so many unknowns that come with having a new baby, even if it's a second baby. So we see a lot of worries throughout pregnancy, worries about the baby's health, or even maternal competencies. Thoughts like, am I a good enough mom? Will I be a good mom? Now, when the worries get more challenging to control or just start to interfere with a woman's life, then we make categories as more of an anxiety condition that needs intervention. And one thing to keep in mind is that both postpartum depression or depression in general and anxiety in general are not culturally bound. So we see women across cultures from every socioeconomic background struggling with these conditions.
Yeah, so that's very important to note because in some ways we can't predict ahead of time who's going to experience this and who's not. And I feel that's important because that can reduce also feelings of shame or just kind of wondering, why am I struggling with these kind of moods and thoughts?
Absolutely, yeah.
It's interesting too with the anxiety component because I'm curious what the trends are going to be like because of COVID-19 and how are we going to see a spike in that, or are they going to stay the same? It's so hard to tell.
Absolutely. Like we were talking about earlier, it's just such an unpredictable time right now, and uncertainty often breeds anxiety. So my guess is that a lot of new moms maybe experience even greater anxiety than what we had seen previously.
Right. So I know in the past there was quite a bit of stigma for women struggling. We talked about a little bit about kind of aspect of it. Is there still a stigma for women struggling with perinatal mood and anxiety disorders?
Yeah, I think you're right. I think it's getting better. We've seen that, there's mental health campaigns on the news. We see there's a lot of discussion on social media, even advertising campaigns like Bell Let's Talk Day. It's really raising our education and awareness around mental health. But it still remains stigmatized, unfortunately, and particularly in the perinatal period. It may be even more stigmatized because there's a lot of misconceptions associated with pregnancy and postpartum. So, for instance, we often talk about women glowing or blooming during pregnancy and how an exciting period of time it is. And in the postpartum period, we see, images on the social media and the news of these women so put together and so happy, when it's a very challenging time for everyone. And a lot of women, unfortunately, in the perinatal period feel that they must portray this kind of image of happiness out of fears that their struggles will be judged.
Yeah, I also found it very interesting because we do talk more about postpartum, and we've talked about postpartum depression. And I remember when I was going through my pregnancy, just the awareness of like, this could even happen before the baby comes, and there's that prenatal piece, right? So.
Yeah, and actually that's a really great point. It kind of brings me to the next area I wanted to talk about, was the risk factors of developing a perinatal mood disorder. And one of the greatest predictors of postpartum mood and anxiety struggles is prenatal mood and anxiety. So for instance, if a woman has a history of depression, maybe 5-10 years ago, she's more at risk of developing postpartum depression. Or if she develops some depressive symptoms in the prenatal period, she's more at risk of postpartum depression. Another risk factor we know of is low social support, either provided by a woman's family, her partner, or friends, or just general stressful life events can be a predictive factor of perinatal mood disorder.
So I guess, just taking all of that into account, like it's so important for us to communicate, have these conversations, especially now, just kind of talk to someone about how you're feeling so we can identify those early risk factors. And
absolutely. And just awareness, like, have I struggled with an anxiety or mood disorder in the past? If so, how can I buff up my social support? How can I keep myself both mentally healthy or psychologically healthy in the perinatal period to kind of prevent that from happening or reoccurring postpartum?
Yeah, and I'm sure you notice this in your practice as well too, but it's always interesting when we have previous clients who are doing well, they've stopped treatment, but then they're expecting and they book in some follow-up sessions, and they actually do counseling sessions just as important as their other prenatal medical appointments. And so it's really interesting how a lot of our clients are mindful of that aspect.
Right. I think that's so important. And I wish all new moms could schedule an appointment or just a couple of appointments in the postpartum period, just as a check-in to make sure everything's going as planned, or if they need additional support, everything is in place.
Yeah, I agree with you. And I think also, like we were talking about social media and culture and just what we observe. And really there is an emphasis of moms putting a lot of their energy and effort to the baby and their family and balance work, and really that message of like, take an hour for yourself to just check in with yourself. We get that message as strongly as we should be.
Yeah, absolutely. And I think as a new mom, and I know you can speak to this too, Jodi, it's hard to prioritize your own time, right?
Yeah.
There's
so time is even a funny concept when you're
it's
in
true.
there. Yeah.
It's true. Absolutely.
So those are some of the risk factors that the literature indicated that we want to just kind of watch out for in ourselves, our partners, or our friends who are expecting. So one thing you kind of talked about is just kind of even experiencing anxiety or depression during the prenatal aspect. So how might COVID-19 impact perinatal mood and anxiety disorders, in your opinion?
Yeah. Just speaking of those risk factors, we know that stressful life events is one of a primary risk factor we see associated with postpartum depression. And this was outside of the COVID period. Now throw COVID in. COVID arguably is stressful for everyone, right? Everyone copes differently with stress, but like we were saying earlier, it's a very uncertain time. It's an unpredictable time. Many people are no longer working. Our partners may not be working. Women may not be working. And it's also harder to participate in those activities that formerly brought us a lot of pleasure and joy, right? So we're really often stripped of kind of the schedule we used to have, those enjoyment activities we used to have. And there's a lot of unknown about COVID-19 and its progression over time, right?
Right.
Additionally, I've heard from some pregnant women regarding concerns about their safety, right? There's kind of limited case studies on COVID-19 in pregnant women and babies being born kind of within the COVID period. So there's a lot of stress and anxiety, which of course can be a risk factor for postpartum depression and anxiety. And also this idea of lack of social support and financial support. There's that saying,
stability, right?
Exactly. There's a saying, it takes a village to raise a child. And I couldn't agree more. While either prepping for the baby, it's nice to have support and help, or of course, in that postpartum, those early days and months, a lot of new parents welcome social support. But given the current state with COVID-19, that village is no longer possible. For some, the village is all outside their windows. It's all through FaceTime, right? It does provide a sense of support over the internet and just seeing family, but it's a lot different, right? There's a lot more restrictions on visitors.
And I'm sorry, go ahead.
And also I was thinking in the postpartum period, I know for myself, I really enjoyed going to those new moms groups because it provided me with, a weekly activity with my child to connect with moms in my area, kind of share our struggles, maybe go for coffee after. And those are no longer possible right now. So these are all stressful life events that have come with COVID or could be stressful life events that may indicate that this period of time in particular places us at maybe an enhanced risk of those anxiety and depressive symptoms.
Yeah, I was just going to also kind of add to that in terms of, like, we're talking about the clinical aspects of depression and anxiety, but I also have noticed with COVID-19, just with this kind of moment in people's lives, there's also aspects of grief, right? And so maybe like it's okay to grieve. This is not how you expected the pregnancy to go, or maybe you might like think outside of the box, and maybe just the interactions are going to look a little bit different. And like that grief is just an emotion that we need to acknowledge. And could you do a little more to that for us?
I think a lot of the traditional customs and norms have shifted recently, right? Even, for instance, going to your family doctor or obstetrician, you no longer can bring your partner or your friend or your mom for instance, these gender reveals. So there is grief there. You can't invite your family to come into the hospital, at least at this point right now, once the baby's born. And so that was, I know for myself, that was something I really enjoyed with my first child. And the second child, it's a lot different, right? I don't even know if my husband can go bring us food if he's allowed to leave. So there's a lot of change. And for some women, they may experience grief, right? They can't have their parents come over to help them daily just because of the risks associated with COVID-19.
And especially like you said, with the unknown, like we don't know about the safety. And it's interesting how you were talking about like just even the comparison between your two pregnancy. And I think the same too, like whether it's your first or your second or third, I think there's some commonalities with like everyone who's expecting right now what this experience looks like. Experience doesn't make it any different for you, right?
Exactly. Yeah, for sure. It's new for everyone. No one's gone through this.
Yeah. And in some ways, I guess I've heard that about pregnancy too, like even before COVID-19, that your first and your second can be completely different too. Yeah. So that's kind of some perspective right there as well too. Like it's easy for us to think, well, if COVID-19 wasn't happening right now, my pregnancy, my birth plan, the postpartum would be different. But, there is that perspective that things can always be different no matter what happens.
Absolutely. Yep, that's right.
So since we're kind of talking about how to cope, I was just wondering what kind of tips do you have for when you might be experiencing this?
Yeah,
right?
So just going back to that stigma, I just want to reiterate, you're not alone if you're feeling a little bit more anxious or you're noticing your mood dip throughout this very uncertain and unpredictable time. One major tip we often give to our clients in terms of a CBT tip is really focusing on that activation, right? Trying to maintain a schedule to the best of your ability and participate in activities within kind of the general recommendations and guidelines. So I like to think of the acronym ACE. There's 3 types of categories of activities, and they're all backed by research. Research tells us that if we fill our days with even a few of these activities each, we're going to start to notice feeling a little bit better. And I think now, even if you're not struggling with mood and anxiety, it's still important to maintain some structure in your day, because like I said earlier, a lot of the structure has been taken away from us. So A is achievement activities. So these are activities that maybe you don't like to do very much in the moment, but you feel a sense of accomplishment or that you've achieved something. So for instance, baby related, maybe sterilizing all those bottles, or prenatal related, making sure you have everything on your to-do list for your hospital bag checked off. Or if it's work related, maybe like, for instance, taking your notes at the end of the day. I know for me, that's more of a challenge, but I always feel like good and accomplished when I can put my work away and just enjoy my evening.
I was just going to jump in and say, I remember I was on maternity leave last year, and just honestly, your definition or your activity for ACE will change greatly no matter what.
Absolutely.
And so for me, even just prioritizing taking a shower in the morning rather than waiting till the end of the day was an achievement activity for me. Right? And so
absolutely,
things like that, it's very easy for us to be like, well, I need to do this for the baby, or just, tired. But having that shower, that sense of achievement at the end.
Absolutely. You feel so much better getting dressed for the day, right?
Yeah, you feel like your normal self. Yeah.
Exactly. Yeah. Now, the C is closest activities. And of course, with COVID-19, these activities look very different. So it's just a matter of doing activities that involve other people. Because what we see with anxiety and depression in particular, we see a lot of social isolation. And with the anxiety, we see a lot of avoidance. So it's very important to stay connected with people, whether it be virtually, through a Skype call, through Zoom, through FaceTime, or texting. Spending time with people in your home, of course, just maintaining that social contact. And finally, just enjoyment activities, doing things that just bring you pleasure, or activities that may used to bring you pleasure, but if you're noticing a dip in your mood, doing them anyways. So for some people, it's getting back into baking right now, or doing some
sourdoughs.
Exactly. And if you're really wanting to reconnect with some new moms, finding maybe a new mom group online, it's just almost thinking outside the box right now.
I was going to say too, with the C, the connecting piece, it's interesting because you did bring up a good point in terms of how partners are not able to because of the restrictions we have, be there for that connecting kind of moment during our appointments, and kind of seeing those ultrasounds, and maybe we don't know what's happening in the delivery rooms. And so thinking outside of the box of kind of still savoring those connection moments with you and your partner, and allowing them to kind of feel involved in this journey as well. It might look a bit different, but just prioritizing thinking outside of the box.
Exactly.
The whole family.
Yes, absolutely. Yeah. And one thing to keep in mind as well is if a woman is really struggling, noticing that her mood is persistently down, depressed, or she just can't get a hold of her anxiety, we know that CBT is one of the most evidence-based forms of treatment for depression and anxiety. So I know in the prenatal and for some women in the postnatal period, they're more resistant to taking medication. I want them to know that, there is help out there. CBT, like I said, it is very evidence-based. So seek, go to the CBT Center for CBT, or find a practitioner who's skilled in CBT to provide a little bit more support.
So what should a person who's looking into CBT kind of look for to determine if what they're getting is more CBT compared to just the traditional supportive therapy, which can be helpful for people, but let's say someone really is looking for evidence-based. What are some tips that you might have?
Well, typically with evidence-based treatment, it's more of a manualized treatment, or we provide certain skills to cover each session. And generally, often, we provide homework every week. So it's not just one session a week and that's it. See you next week. It's one session and then you continue the work. I like to kind of compare it to, say, working with a physiotherapist. If you were just to go to a physiotherapist weekly and not do any of the exercises, you're going to see very small gains, if any. And that's basically the same thing we look at with CBT, is that there's a lot of active work in between the sessions. So often we'll provide a manual or a workbook, provide assignments every week. We'll do homework check-ins. And it's generally more of a time-limited therapy. So maybe 10 to 12 sessions for depression, for instance, give or take. Everyone's different. And of course, it differs according to severity of problems.
Right. And it sounds like also what you were talking about, there's going to be that balance. Like, so you gave us some pointers in terms of like the behavioral activation. And that's so important, even just to begin with, for a lot of moms and families that have this just big change in their life.
Absolutely. Yeah. Behavioral activation is generally one of the first things we work on. And once we have that under control, then we focus more on the way we think about things or our perspective of things. Because oftentimes there's a common thinking pattern associated with anxiety and depression that often can kind of drive those symptoms. So if we're able to get those more under control, then generally we often see a reduction of symptoms.
So I know that we're trying to keep these videos a bit brief, but any other suggestions or pointers that you have for expecting moms, especially during these uncertain times?
Yeah, I know for myself, it's just daily reminders that this is a temporary period of time. It will reminding myself that, although we don't know when it's going to end, it's uncertain. It will end eventually, COVID-19, right? So it's just a reminder that this is a temporary period of time and try to make the best of it with what we have.
Yeah, I think that's so important to end with, because I know even once our listeners stop listening to this, probably the next thing you're going to watch or see is going to be a highlight of the uncertainty and the things that we don't know. But you're right, it's going to end at some point. And then I guess there's also like stability. There's things that, were in your life before COVID and that will be after COVID too. And just kind of paying attention to that. I think that's very helpful. And thank you for taking the time.
You're welcome.
Information. So I guess for our listeners also, if you have more questions or any topics that you find would be helpful for us to talk about, feel free to send us a message on our website, follow us on social media, and we'll try to just keep giving you these helpful tips.
Definitely.
So thank you so much, Nikki.
You're welcome. Do you take good care?
You too. Bye.
Bye.